I'm the Logansport Memorial Hospital Therapy Services Manager, and I am also our Certified Lymphedema Specialist. And I got my undergraduate degree, got a bachelor's in science from Purdue University, and then I went on to get my doctorate from Indiana University, started my career in a small town hospital, and then I came here about 2 years ago. My specialty is in lymphedema management, and so I manage chronic swelling conditions, whether that's from cancer, hereditary, or just a post-op issue. I can manage all swelling issues through the use of compression and manual therapy. What you can expect from the therapy services team at Logansport Memorial Hospital is wonderful, friendly faces, an individualized treatment plan that is specific to your needs. We have specialists in vestibular issues, so ear issues, balance issues. I specialize in chronic swelling. We have an orthopedic clinical specialist. Our occupational therapy and speech therapy teams are also great, so you can expect wonderful care and an individualized plan for your needs. We have about 15 of us in our department, and we all have our own special interests. Like I said, I'm specialized in swelling. We have 2 vestibular balance rehab specialists, an orthopedic clinical specialist. We also have wonderful PTAs and assistants, occupational therapy assistants that work very closely with your physical therapist, your occupational therapist, and they all are wonderful at what they do. You can need therapy services for a number of reasons. If you're falling, if you feel like you are just having some typical muscle weakness, if you are not able to do the activities that you used to be able to, and you're just not seeing a reason why, you can always come to us and we can see what your needs are and develop a plan specifically for you to get you back on track. So as we're entering colder weather, number one, your joints can be hurting a lot more. So that's a great time to come into physical therapy to help you decrease that pain that you're experiencing from the change in the weather. But also as we start entering into winter, which we don't really want to talk about yet, but ice is coming. And so if you fall, you know, the ice is definitely an added increased risk for fall. And if you're falling, that leads to other injuries, especially in the elderly population. We can have a lot of fractures. But if you're noticing now before the weather's changing that you're falling now, it's a great time to come into physical therapy and get a plan together so that we can prevent those falls in the winter time where you can really injure yourself. Falls, once you have one, you're bound to have another, and especially if you're not just tripping over things. So it's a great time to get early intervention if you notice you're maybe stumbling a little bit and you don't know a reason why, so that's a great time to come into therapy. Having trouble swallowing, if you take a drink of water and you notice you always cough afterwards, that's a great time to talk to your doctor about, I always take a drink of water and I cough afterwards, because you might be aspirating, and aspiration can lead to pneumonia, which can lead to further issues. So it's a great time to talk to your doctor and get in early with our speech therapist, and she could develop a plan for any swallowing issues you might be having. Or if you're noticing, I'm just not able to put tasks together like I used to. You know, step 1 to step 2 is a little bit more challenging. That's a great time to talk to your doctor as well and get a referral for our speech therapist and see if there's anything she can do to help you with those task-oriented issues. You do not need a referral for lymphedema. You can actually come directly to our office and I can see you for 42 days before you would need to see your doctor. However, if you're already in with your doctor and you're at your doctor's appointment, you'd like to talk with them about any of your swelling issues, you're noticing your clothing isn't fitting quite well, or you're noticing your skin is just a little bit too tight, it's a great time to talk to them, get them to see your issues, and then refer them on to me for your lymphedema issues. Or if you have just regular swelling issues, you're not recovering as fast as you would like to after a post-op, please just talk to them about it and get them to send a referral. You do need a referral for speech therapy and occupational therapy. However, you do not need a referral for physical therapy. So if you're having issues with falls or anything from your neck, your lower back, or your legs, you can come on in. We can set you up with an appointment, and like I said, we can see you for 42 days without a referral. However, if you're having issues from your shoulder down and you want to see occupational therapy, please speak with your doctor and get a referral for your issues. And any swallowing or cognitive issues, if you would like to speak with your doctor and get a referral for speech therapy, we are happy to see you as well. If you have any further questions about any therapy needs, you can call 574-753-1380, and you can ask us any questions that you may have.